Healthcare is something we all need at some point in our lives. But here's a big question. Should healthcare be free for everyone? This is a topic people feel very strongly about. Some think it's the right thing to do, while others worry about how it can work. Let's explore both sides of this important issue together. Imagine you or someone in your family is very sick. Maybe it's something serious like surgery or medicine that costs a lot of money. What do you do if you can't afford it? For many people, this is a real problem, and that's why some argue that healthcare should be free. They say it is a basic human right. Everyone, no matter how much money they have, deserves the chance to get treated and stay healthy. Countries like the UK and Canada have healthcare systems where the government pays for medical services. This means you don't need to worry about paying a doctor or hospital. Instead, the system is funded by taxes that everyone contributes to. This ensures that even the poorest members of society can see a doctor when they are unwell. It's a way to make healthcare fair and equal for everyone. Doesn't that sound like a good idea? But it's not always so simple. Let's think about how free healthcare works. When governments provide healthcare for free, they have to collect a lot of money through taxes. This can put pressure on the economy. For example, if taxes are too high, people may feel they don't have enough money left for their own needs. Some critics say this system makes things harder for businesses and families. Another problem is that free healthcare systems can become very busy. Imagine you need surgery, but you have to wait months because so many people are using the system. This happens in countries with free healthcare. When everyone has access, hospitals can get crowded, and doctors may not have enough time for all their patients. Long waiting times can be frustrating and even dangerous for people who need urgent care. There's also the issue of misuse. Sometimes when something is free, people don't value it as much. They might go to the doctor for minor problems, like a small cold or a headache, even when it's not really necessary. This can make it harder for people with serious illnesses to get the care they need. It's not fair to those who truly need medical attention. Now let's look at the other side, private healthcare. This system works differently. Here, you pay for the care you receive. If you can afford it, private healthcare is often faster and offers more choices. For example, private hospitals usually have more advanced equipment, and doctors may have more time to spend with each patient. This means people can get high-quality treatment without waiting for long periods, but private healthcare has its downsides too. The biggest problem is cost. Private hospitals and doctors charge a lot of money. If you don't have enough money, you might not be able to see a doctor or get the treatment you need. This creates a big gap between the rich and the poor. Wealthier people can afford excellent care, while poorer people may struggle to get even basic medical help. Is that fair? So what's the best solution? Some experts think a mix of both systems might work best. This is called a hybrid system. In a hybrid system, basic healthcare services like visiting a doctor or getting emergency treatment would be free for everyone. This ensures that no one is left behind, no matter their financial situation. At the same time, private healthcare would still be available for those who want or can afford faster and more specialized care. It's like having the best of both worlds. For example, if you break your arm, you could go to a public hospital to get it treated for free. But if you wanted a private room or extra services, you could pay for that. This way, everyone has access to what they need, and those who want more options can still choose private care. This discussion isn't just about money, it's also about ethics. What kind of society do we want to live in? Is it right for someone to suffer because they can't afford treatment? On the other hand, how do we ensure that free systems aren't abused or overburdened? These are tough questions with no simple answers. It's also important to think about how healthcare affects society as a whole. When people have access to healthcare, they stay healthier and can work, study, and contribute to their communities. This benefits everyone, but if healthcare systems collapse because they cost too much or don't work efficiently, the whole society suffers. In some countries, the debate over free healthcare is very heated. People on both sides feel strongly about their opinions. Supporters of free healthcare believe it creates a fairer world where no one is left out. Critics argue that it's unrealistic and that private healthcare systems are better at encouraging innovation and providing high-quality care. So where do we go from here? Maybe the answer isn't one system or the other, but a balance. By combining the strengths of public and private healthcare, we can create a system that is fair, efficient, and sustainable. For this to work, governments, businesses, and communities need to work together to find solutions that benefit everyone. What about you? What do you think is the best way to make healthcare accessible for all? Would you prefer a system where everything is free, or do you think people should pay for some services? Or maybe you think a mix of both is the right answer. At the end of the day, the goal is clear: to ensure that everyone, rich or poor, has access to the care they need. How we achieve that is up to us as a society. It's not an easy question, but it's one worth thinking about.